So the other thing I sometimes get asked is, well, how's ABF going to change a routine day for a clinician? And the realistic thing is that current day-to-day practice, particularly in the immediate future, is not really going to change. It will encourage us to foster causation-based thinking in our juniors, and I think that's a really good thing in terms of medical education. We'll have more interaction with coding staff, and they're pretty nice people. I know a couple of them. We will be more accountable along the way, and we'll be able to develop a better awareness if we have these data systems correct about how we're treating our patients in relation to our peers, importantly, and why we're doing it that way. In terms of what challenges the future hold, as we've heard this morning, we don't yet have all the answers. And I guess that's okay because we know we're all on the same page and we're all striving for the same goal. I think educating and engaging the clinician workforce needs resources allocated to it. We've talked about the potential of changing the medical school curriculum, but if you have any experience with that, that's not such an easy thing to do, but just to be aware of that and to focus some education into the medical students. Avoiding clinician engagement, and I've mentioned some strategies along the way. Valuing education and research again. And then auditing the process and measuring the right outcomes. And this is another critical part of the process. A lot of our outcomes at the moment are performance-driven. And with a patient-centred approach, clinicians often focus on very different outcome measures. And patient satisfaction and clinical outcomes need to be a very important part of this. And we're not quite clear at the moment which outcome measures we're going to measure and how this is going to evolve over time. And with the focus on activity and budgets and everything else, it's really important also to not forget about the patient in front of us. And no one says it better than Sir William Osler, who's a clinician, one of the founding fathers of medicine. And basically, he sums it up beautifully when he says, it's more important to know what sort of patient has the disease than what disease the patient has. So we shouldn't lose focus of the patient in all this as we concentrate on DRGs. Thank you very much.